So here guys, we're going to recap the techniques that we showed you this month. We're showing a fair amount of techniques, so this is just a quick review at the end of the month, just in case anything slips your mind or you want to go back. So I'll give you a quick overview. Skin rolling. Grasp the skin in between the thumb and the index finger and just wave the tissue out. We use this as a treatment and an assessment. Hilton's law says if there's tension in a skin segment, suspect an underlying dysfunction to the muscle and or joint underlaying that segment. If you find a sore spot, we can treat it right now or place a marker there, finish our assessment and then come back. So get used to skin rolling, great technique, very, very powerful. The Socko stretches. First one we done was coupled. So we lift the knee gently and we slide the hip to as much flexion as the client will give us. So Kiki's giving us about 120, 130. I block with my lower leg or my upper leg, lower part of my upper leg. We can do some gluteal releases here. We can come on to trochanter to create some anterior gliding and sliding of the femur. We can mobilize the anterior portion of the capsule here. And or we can just hold this position and stretch. Key thing is when we finish this position, grab the knee, bend my knees, slide back, give it a little shake. Now we do this uncoupled. Same thing, grab, slide up, here. Now we're going to move Kiki's leg into internal rotation. This is what we call uncoupled biomechanics. So now we're going to rotate Kiki's leg this way. Hold that stretch. A couple of different ways of doing this. I can go onto my shoulder, brace her knee, and hold. Not all clients are going to have this range of motion. This may lead to medial knee pain in some clients. If it does, this is not the technique for them. We may have to go to a more of a neutral hip internal rotation first. I can come around this side. Work the hip. Different angles, different looks. When I finish, grab the knee, slide back. Deep six. Key things are PSIS, inferior lateral angle of the sacrum, greater trochanter. These 3 points form like a T triangle, so we know the piriformis is housed in between those 3 landmarks. When we're assessing the mobility of the hip, we initially test slowly. We want to feel the quality of this movement. Ask for any pain, impingements. We want to feel how it feels at the end feel. It should feel nice and firm. It shouldn't be like a hard block. It shouldn't come to a dead end or a real aggressive stop. It should be a firm stop. This is what we want. When we're treating this area, slacken the tissue, go in at an angle, so I'm not directly down, I'm slightly angled, step away. This one feels a little tight today, and we treat. Release my pin, go. When I'm doing this in a real bodywork session, I release my pin, but I don't do this. It's more like this. So on camera, you won't even see. Here I'm pushing, I release, but I stay in contact with the skin, and I literally move. Boom. I move. So I never take my hand off. Kiki's going onto her back, please. first technique we showed you guys, that handshake, greet your client, handshake, and then this is a therapist handshake. Let's make that up today. It's pretty cool. Just rotating the hip. Different speeds, different circumferences, different angles. Sometimes with a bit of compression, sometimes with a bit of distraction. Compress, distract. Straight legged, here, rotations, different angles like we showed you in the first video. Lateral line. I'm going to stretch Kiki's left side. We flex the hip up to about 45 degrees. It goes across the body one way and the opposite leg comes across the other way. If the client's flexible enough, I'll come in with a knee this way and stretch. So we're stretching the left side here, guys, but we're using the right to help us. Here. Here. We want to keep this hip down. Here. Lateral line. Kiki can reach across her face with her left arm, and that's going to further exaggerate this lateral line stretch. As I push, reach. So now she's trying to reach up, and what's that is doing, guys, that's separating her ribs from her pelvis, which is going to open up QL, obliques. The last one is Texan. She's going to, above her neck here, this leg comes across and I hook it. Boink. We can use a towel if you're creating a lot of pressure, and or you can push on the TFL. Grab the elbow, pull, cradle. Grab here. And we're pulling and pushing. I'm slightly side on, so I'm going to be this way, side on, and I pull, push. So I'm pulling, pushing, we hold 1, 2, 3, take a deep breath in. They breathe out. Exhalation is coupled with flexion. This is flexion. So she breathes in, she breathes out, that's coupled with flexion. Stretching QL. So that's just a quick overview. If there's anything you missed and you want to go back, of course go back to previous videos. If you want further explanation of the 7 techniques we've showed you, ask and we shall do. Anything else to add? Thank you, guys. Next month, by the way, we are going to be going through some loaded lat techniques, some soleus work on the lower leg, lateral glute and subscap, and some bicep work, as well as some other rotator cuff releases. That's coming next month. And by the way, we already have the whole year planned. We have 100 videos scripted and ready to go. But if there's anything you guys are yearning to see, let us know and we'll add. It's your academy, right? So we'll do what the masses want, to be honest.